little cavities between the two levels of the meninges. Okay, and so that's why they're called dural sinuses, because the outer layer of the meninges is called the dura mater. So that's this white stuff that we see here. The function of the sinuses is to return blood, spent blood from the cerebral circulation back into the venous circulation and take it from the cranial cavity. So that's what they all do. So they basically function like veins. Okay, so the biggest one is the superior sagittal sinus, which you can see just below the superior bones of the skull. So frontal bone, parietal bone, and there it is right there. That's the superior sagittal sinus. That's looking at it from the side view, like you'd have a median sagittal plane there. If we look at that in the cross-sectional head, it just appears as an anterior and a posterior portion. So that's the superior sagittal sinus. It goes in an arc there. If you follow that posteriorly, eventually it's going to come down here to the area of the superior nuchal line on the occipital bone. We get this large kind of M-shaped structure there. And that's the transverse sinus. Where the superior sagittal sinus meets the transverse sinus, that's called the confluence of the sinuses. That's also where the straight sinus comes in, and the straight sinus runs between the cavernous, well, not really between the cavernous, runs between something called the inferior sagittal sinus, which is here, and then back through the medulla and through the cerebellum. That's a straight sinus. We don't really see that in this level. I think you'd have to come up a little bit and you just see a little bit of it here. So that's a short one. Straight sinus comes into the confluence. So then we go laterally and anteriorly through the transverse sinus. Then we get to a kind of a downspout that goes down, and it drops down a few levels. So that's what we're seeing here. That's the beginning of what we call the sigmoid sinus. So it drops down, and then the reason it's called sigmoid is down here near the ear. It takes this kind of curving S-shaped route, so it's called sigmoid. And the sigmoid sinus, the terminus of that is the internal jugular vein. And then we go out through the jugular foramen and down through the neck. The only other ones to know, up around the area of the sphenoidal sinuses, which are, it's a different definition of sinus, right? These are the perinasal sinuses. Around those cavities in the bone, we have kind of a large pocket of loose vessels, and that's called the cavernous sinus there. So that's around the sphenoidal perinasal sinus. These blue vessels are the cavernous sinus. And they're connected via something called the petrosal sinus, which runs over the temporal bone and comes back to the sigmoid. And you don't have to know the petrosal. So the ones you should know are cavernous here, around the sphenoidal sinus, the sigmoidal, transverse, confluence, and what comes together in the confluence is the straight sinus, which really is hard to see, and then the superior sagittal.
Okay. The M1 is the transverse?
Mm-hmm.